Hospitals are challenges because we deal with many different illnesses, with different type of patients, and how can we accommodate those patients? How can we provide the best treatment?
I went to donate blood one day. They said, you have low plasma. I'm like, what do you mean? She goes, well, you can't donate blood because you don't have no plasma level. And I'm like, that's interesting. But then all of a sudden, I started feeling tired more and more every month. It was just like a tired where you have no energy, nothing's going on, and there's not an energy drink in the world that can bring you out of that tiredness. So then I went to my primary doctor, and I said, look, something's wrong. I know something's wrong, but run every blood test you know and everything to see what's wrong with me.
We have a cancer program which was very limited. So we began a conversation with City of Hope, and actually we developed a relationship. Now our patients get all of their care in the hospital. They don't have to leave the community. They don't have to travel anywhere.
The team here at Humboldt Park Health is really committed to every family, children and adults, and it's really quite refreshing, having been at some of the leading institutions, how committed the CEO and the entire leadership team and every staff member is here to making sure that every patient's outcome is outstanding and their experience is wonderful.
They made sure all my internal organs were fine and everything else. And then when they did the labs, that's where the red flag came into play. She called me that same day saying, you need to go see a specialist. And I was like, wait a minute, isn't that a cancer doctor? And she goes, yes, but you have to see one ASAP. I called County Care because I only had that type of insurance, and they said that they have oncology here at Humboldt Park. I was like, great, I will set up an appointment. They were actually able to see me that same day. And then when Anthony had my labs done, wow. He said, you need to sit down right now, we're doing an emergency phlebotomy because your blood level's at 63.2 and it's supposed to be below 50. So that's how I ended up at Humboldt Park. And that's how I ended up knowing about the blood cancer.
But it's about empathy. How can you relate to your patients? How can you listen to your patients? That in itself is a cure. They wanted to be heard. They wanted to be valued and understand as a human being. And that's something that I try to discuss with my staff on an ongoing basis.
We don't just treat illnesses. We care for people within the context of their families, their communities, and their life stories. Over time, those enduring relationships become the foundation for better health outcomes and true healing.
We want to hear what works, what doesn't work. Because at the end of the day, we are here to really serve them. It's not about them coming to us. We want to serve our patients.
They'll take care of you. You know, you might be nervous at first because I was very nervous and I was very scared too. And me being a grown man, I was still scared. I didn't know what to expect from the people here. That's what I like about it because they are very nice here. They think you like family, and they will get on you too if you mess up. I know because Anthony has before already. I know. Mm-hmm.
Our residents quickly learn that being a good physician is just as much about humanity as it is about medical knowledge. We can teach the science and the skills, but at the end of the day, what truly defines great care is the human connection. Through mentorship, reflection, and everyday patient encounters, we help them see that empathy, respect, and listening are just as important as diagnosis and treatment. That's what it really means to put our patients first.
Come by the hospital. Come by and take a tour. You'll see, You'll see where your money is going to. And it's definitely worth it, especially the gym. Lovely pool. You gotta come and see the heated pool.
Your dollars today, your support for a hospital is clear. What we are doing is making an investment in our patients, in our community. And as you walk away tonight, I want you to think about the critical impact that we have in people's life, because it's all about that. It was about 16 years ago that this hospital should have been closed. Today we are thriving as a healthcare institution.
Without Humboldt Park Health, I would be dead. I would actually be dead, because even Anthony told me in the beginning, he was like, I'm surprised you're still alive, because your blood was so thick, you could have had a blood clot to your heart instantly.